Hi, this is Dr. Brittany Todd, and this is the Pain and Fever Dosing Guide for Infants and Children, available on Amazon. It is only $14.99, and it is the best thing you will ever buy for your medicine cabinet, aside from having just acetaminophen and ibuprofen products for your child on hand. Put this next to those products. Well, what is this? This is a dosing guide that helps you decide what dose to give your child, your individual child, at their exact weight. So currently the bottle would say, you can give 24 to 35 pound children 5 milliliters of the acetaminophen suspension. Well, that means a 24 pound child's getting 5 milliliters. Maybe that's the high dose for them. And a 35 pound child is getting 5 milliliters as well, and that's the lowest dose you can give them. So this dosing guide lets you individualize the exact dose. So if you have a 34 pound child, you just find them on the chart, 34 pounds, you go over, and it says you can give anywhere from 4.9 to 7.2 milliliters. And you can decide as the parent or caregiver, do you want to go with the low dose? Do you want to go with the high dose? That's your decision, but you know that whatever dose you give them within that range is the dose appropriate for your child. This includes acetaminophen suspension and rectal suppositories and chewable tablets for the acetaminophen. And then it also includes infants' concentrated ibuprofen and children's regular ibuprofen. So just make sure you know which one you're using so you don't give the wrong dose for your child. And it has the chewable ibuprofen tablets for children as well. This is the most amazing and useful guide you're going to ever have. One thing I like to say is sometimes you'll get the approval from the physician that yes, you can go ahead and use over-the-counter fever-reducing medicines for your baby. Go ahead. But you don't know the dose. It says ask a doctor if they're under 2 years old. So you could ask the doctor if they get a fever at 6 months and 12 months and 18 months, but they're all different doses and you keep having to call the doctor. Well, if you have the go-ahead from the doctor, why not just use this booklet and say, okay, at 6 months, my baby weighs 20 pounds. So you can look it up and say, okay, that's how much acetaminophen my child gets at 6 months. And then maybe at 12 months, they have another high fever, and you're like, great, I have to treat them again, and they're like 24 pounds now. So you go to the 24 pounds, and you can find the dose. You don't have to call the doctor again. Let's say they're almost 2, but they're not quite 2, so you can't quite give the 5 milliliters yet, but you know that they're about 28 pounds, so you can do that. How easy is that? The other cool thing about this dosing guide is at the very back, there are 20 of these dosing schedules. And the dosing schedule tracks your child, their weight, and the date, and then you can choose whether you gave acetaminophen or ibuprofen, what dose you gave them, at what time you gave it, and then any notes. Maybe they had a fever of 102, you want to write that down, or they had some vomiting, you want to write that down. But this helps you track what your child got, and then if you happen to switch caregivers, parent 1 is taking care of one kid, and then parent 2 comes in to take care of the kid, they can see exactly what was given at what time and how much. This is the best thing you can put in your medicine cabinet aside from the actual medicines that you have. So get this on Amazon. It's called the Pain and Fever Dosing Guide for Infants and Children.